The best thing is helping people get back to do what they were doing before. A lot of medical professions, you're making sick people better, but with this, you're getting people active to stay healthy, to do the things that they want to do. A lot of patients will injure themselves doing sports, and so you're getting them back to the playing field. As a general orthopedist who also does a lot of sports medicine, I take care of a lot of knees and shoulders. Those are probably two of the more common things that I take care of. A number of ACL injuries, which is the anterior cruciate ligament, that often gets injured with high-level sports. Those are some of the main things that I do. But I also take care of common broken bones, foot and ankle injuries, sprained ankles, you name it. Really everything but the neck and the back. The ACL tears can be treated without surgery. I'd say I fix more of them and reconstruct them more than I don't, but a lot of it depends on the activity level of the patient. If it's a patient who injured their knee and is a high school athlete and injured it playing basketball or football, that would be a perfect indication to perform an ACL reconstruction because they want to get back to their level of sport. So a lot of times you need your ACL reconstructed in order to perform at a high level. Now, if it was a patient who leads a very sedentary lifestyle, one thing we could try is putting a brace on that patient and doing physical therapy. And a lot of times that patient might get better. I'm at the games making sure that if they have any injuries, whether it be something that happened during that week in practice or whether it happened during the game, that I'm there to help them, take care of them. A lot of what I do are sewing them up during the middle of the game, but a lot of them will have bumps and bruises over the course of the week and they need to be evaluated by the team doctor, and that's what I do. I decided to come back to Austin and practice for a couple reasons. One, I grew up in Central Texas. I'm from Boerne, Texas, which is north of San Antonio. I grew up there and did high school, and I have a lot of family that still live there. I did undergraduate at University of Texas and played football here in the 90s. Did my medical school training out in Houston, and then I was gone doing my orthopedic residency at Duke. And when it came down to looking for a job, I was fortunate enough to get in contact with Texas Orthopedics, and the rest is history. It's a great practice to be a part of, and I was fortunate that at the time I was coming out of training that they were looking for somebody to come back into the practice.